Welcome to episode 3 of the Curious Cuenca Podcast by YapaTree. Today's guest is the wonderful Doctora Maité Depreeuw. Doctora Maité is originally from Belgium, but now lives in Cuenca and works as a general practitioner. I cannot think of anyone better to talk through today's topic of healthcare in Cuenca. Maité favors a holistic approach to medicine, which in my experience is really quite hard to find within Cuenca's medical establishment. I am very excited to have Maité here with us today. And just a quick note about this podcast, if you do get value from it, we do encourage you to donate to Cuenca's charities through the link on our website. We don't take a cent from these, and we just act as a conduit to connect our listeners, particularly those who are yet physically to arrive in Cuenca, to the many deserving non-profits that make Cuenca and Ecuador a better place. Right, let's talk healthcare with Maité. Thanks a million for being here today, Maité. I know that you're very busy, and so I do really appreciate you taking the time out of your schedule to come and talk to us. Welcome to the podcast.
Thanks for having me, and I'm happy to be here.
Awesome. I think it's safe to say that you have effectively become the default GP of choice for many expats who have moved to Cuenca. I know I certainly send a bunch of expats your way whenever someone asks. And I also put my family in that basket because you have been, I guess, our family's GP for a couple of years now. And we will get to why shortly. But just first, can you just tell us a little bit about your background and what brought you to Cuenca?
Well, in a nutshell, I went here in 2012 for the first time on an internship. We call it overseas internships, where we can go 3 months in another country. And fate brought me to Ecuador, Cuenca, and I worked here at the public hospital for 3 months. But then, of course, I fell in love, and that's the main reason why I'm here. But I do love Cuenca, and it's my home, and I love working here. I have, after a couple of years, finally established my office, which I've been now in for 2018. Yeah, 2018 I started. It was a bit of a rough start because I arrived here in September 2015. But in order to be able to practice here, I had to do 1 year of rural service.
Where was that?
In Guachapala, a little bit over Paute.
See, they have an aquatic center. We were there on the weekend, right?
Yes, right there. And the healthcare center is just beneath it.
That's a beautiful spot.
It was. It was quite an experience because it was the first time really working here and working in the public healthcare sector, which was pretty hard because you work with people who can't afford not even sometimes a taxi ride to the healthcare center. So, but it was a very enriching experience, and I think made me a better doctor, made me understand better the system as well, how it works here in Ecuador. And then
that's kind of great. Like, if you didn't do that rural work or just acclimatizing to the system, do you think you would just really struggle, or what sort of advantage did that have for you?
It has an advantage on knowing how people sometimes think about their health, because there are some cultural differences between Ecuadorians and expats. I see that a lot. And also how the system works, because Ecuador, as we know, has 2 different systems. We have the public and the private, and they are 2 completely different systems. And the public healthcare has a lot of difficulties, but at the way they can offer health service to people who normally would not be able to afford private. So, and also what helped me most, I think, was the availability as well of medication. Because for me, that's still a difficulty here, is I was schooled with generic medication, with what should be, what not be, but then here in guidelines they use quite different ones, and then
different brands of the same medication,
sometimes different names, different brands, or the one you want to prescribe is not available, and there is no system like we have in Belgium that you can just look up online and say, okay, I want this medicine, what do we have available? And there is none. So that helped a bit on knowing what is available, what not. But I think the first year of really working as a GP where I just was calling the pharmacy all the time, like, "Hey, is
What do
this
you got?"
available? Can I prescribe this?" So that helped as well.
So-
But learning that in the public was interesting too.
Just going back to the start a little bit, I'm interested. You said the 3-month internship that you were here. Was that sponsored through the Belgian government, or how does that work?
No, that was paid out of pocket. So we, as Belgians, or at least in my university, I studied at the University of Ghent. We have, in our last year of medical degree, last year, the ones who want to have an option to go overseas. To do a part of their intern year overseas, and it's 3 months because you have to do 3 different specialities, and we have to do a paper for that about third world countries and healthcare systems, how they work. There were classes about it. Then we had an exam, a test that we had to do, and then we could choose from who scored better to the one that didn't score well, and we go down the list. Yeah. My idea was always Africa. I was always wanted to go to Africa because I didn't want to learn another language. And here I am fluent in Spanish, but...
Yeah, I was going to say, how many languages do you know?
4.5.
4.5? What's the half?
German.
Very cool.
Yeah,
do you
German.
have that many German customers?
I do. I do, actually. There's a German school here. So the teachers, they know how to find me now, too.
Oh, so all the teachers come to you?
The teachers come to me.
Wow, that's really cool. Great stuff.
So at the end, I went to Ecuador, and I did a month of pediatrician in the Hospital Vicente Corral Moscoso. Then I did gyno, OBGYN, and then I went actually for a month to Macas in the Amazon, and I did general practitioners there.
Wow. So you've decided, obviously, to go down the GP path.
Yes.
But it sounds like that wasn't always set in stone for you. Like, were you close to going down a different path?
Actually, it was a hard decision because when I was doing my intern year, I loved it all. And everybody was saying, "Oh, you should be a peds, you should be in gyno, oh, you should be internal medicine, you should be this." It's like, I like it all, yes. So let's be a GP. Yeah. So it wasn't carved, but at the end, after my intern year, I just felt that was the best choice. And I just have not regretted my choice. In Belgium, it's not the easiest choice because it's from all the medicine professions that we have. We divide in Belgium into family medicine and hospital medicine. And of course, the ones who work in the hospital are the richest ones, so everybody wants to go and do that. So our little group of family practitioners was always a little group, but we were passionate about our decision. And going back on the question, I had to sponsor my own trip, but the university gave us the opportunity to go and get.
So they had the program in place, but you just had to fund it yourself.
You had to fund it myself.
Got it. Well, I'm glad that you did. And one of the things that I really like about your approach is it's the holistic medicine. And that's, in my experience, really difficult to find here, at least in Cuenca. That's my sphere of reference. Maybe it's a little bit more easier to find in Quito. I'm not sure. But here in Cuenca, that really, in my opinion, kind of sets you apart from the other doctors. And so I guess my question to you is, what does holistic approach to medicine really mean, coming from your mouth?
Well, for me, holistic is I see the person. I don't see the symptom or the disease or whatever you want to call it. A patient comes in and it's the patient I'm talking to, not a patient with a headache, and we need to know what the headache is. How does that patient feel that headache? Where is it coming from? How does it affect his life? It's about the patient. That's for me the holistic part. It's the environment, the person itself in this environment, stress factors that are attached to it, the way they believe about their health, because a headache can be very different from one person to another, having the same pain, but they experience it different the way it affects their life sometimes. There's even cultural differences as well that I have learned to know, because in my practice, I don't always have from the US or Canada. I have from Russia. I have from Belgium as well, or Europeans like France, Germans. But I have from Ukraine, Russian. I even have one from Iceland, which has such a small population. But I have already one patient that once came
awesome.
from Iceland.
What language issues do you have? I know you speak a bunch of languages, but are there some patients that you need a translator or anything like that?
For now, I've not had to need to have a translator. It was once a bit difficult with a Portuguese one, but at the end, Spanish and Portuguese with my French on top of that, I was able to communicate well. And like I always say, like if you can't say it in English or whatever language I know, try to say it in your language, and I'll try to understand.
A lot of the medical terminology does tend to be pretty universal, right?
Yeah, and symptoms as well. It's not that there's such a different term for it.
Yeah.
So at the end, I've not had. No, it is not true. I've had once to use, but that was an elderly. That was the mom of somebody from Ukraine, and but then we had to use the translator. Yeah,
Got it. But just like Google Translate, or how did you do that?
It was something, I don't know what it was. The mom had it on the phone, and it
Like real-time
speaks.
translate?
Yeah, it speaks, and then it just translates
Fantastic.
right away.
She knew what she was doing.
Yeah, she's been living here
Exactly.
for 5 years,
Yeah.
so she already had it on hand.
Awesome. I am really curious as to just like what a normal day in your life as a doctor here in Cuenca, what does that look like?
Well, my days vary. The fun or the stressy part of my job is I never know what I'm going to get in the day. Because you can say, like, yesterday I had a quiet day. I thought my office visits were going to be quiet, but at the end it was more complicated because you never know what patient comes into your office. And I have appointments every half an hour. I make appointments. Before it was 45 minutes, but then sometimes I had too much time in between, and then I started to do it half an hour, but that's also not working out.
It's too short?
It's too short, and 45 is too long.
Right.
But yeah, that's I just have to figure that out. But sometimes it works perfectly, and I'm home on time. But then there's other days, there is a patient who first time tells me about trauma in their life that they never thought that were going to tell me.
I was going to say, the holistic approach, it seems like it just takes more effort and just more time to really get into, how do we isolate the problem, or whatever the case may be.
And that's why it's hard to sometimes calculate time, because like a holistic approach is you take care of the patient, not the problem. You take care of the patient. Of course, the problem is in there too. But if a patient is having, for example, recently had one with tachycardia, heart rate was rapid. And she first didn't want to talk too much about it. So I let her speak, and then I find ways that I can enter, that I can feel, okay, there is something wrong. I work a lot with gut feeling. So sometimes people say, why do you do that? Like, it's just a gut feeling. Or why do you think it's more heart or lung related? It's a gut feeling. So I felt that there was something more. And at the end, she was suffering some abuse at home. And that's what the reason was the tachycardia. So she came for palpitations, of course, but then there was way more. But that didn't take me half an hour. That took me an hour.
Of course. So you've got 2 patients waiting outside.
But my patients normally know that I will always take the time they need. Yeah.
You've always been very patient with us. Honestly, I never even knew that the appointments were 45 or 30 minutes. I'm sure Michelle probably took a little bit more notice than I did, but it's always been fluid. And every time we've gone, I don't feel like we've been rushed through the machine or anything like that.
Even if there's 3 or 5 patients outside, I will not rush. It's my problem for time management control, which I still have to learn. But I do try, and sometimes I put like a half an hour of playroom in there. Then I know okay, these patients are coming, and I know this takes sometimes a bit more time. So, or put 15 minutes in there that I know, okay.
Especially with a new patient, I'm assuming you try and manage that a little bit.
So if I have, for example, 3 or 4 new patients in that day, I do put a half an hour free that I know I'm going to run. And I don't like to be late. I'm European. So I don't like to be late. I like to be on time. And I
Are
feel
most of your customers, or not clients, what do you call them? Patients, sorry.
Yeah, patients.
Are they mostly on time?
Most of them, yes. Yeah. Actually, if you look at expat community, expats are on time. Ecuadorians are not on time.
But so that's a good little break. So I know obviously, I know that you deal a lot with expats, and you know, we send expats to you as well on purpose. How much of your patients are expats versus locals?
I would actually say 90 to 95% would be expats. Yeah. The problem here in Ecuador, whole Ecuador, because even in Quito, I've talked with colleagues, family medicine or having a GP is not something common. They have lost the sense of having a GP, because before we had médico de cabecera. Like my parents-in-law here, they had their médico de cabecera, and they came to the house, or the doctor came to the house. They can come to the office, whatever, but they had their family doctor, and that here has gone away. And I think it's also a bit because of the system is so open. Meaning in the public, you have to go through the system. But in the private, if you want to go and see the traumatologist right away, you go. If you want to see the cardiologist right away, you go. You don't need somebody in between to guide you. Yeah. And so they have learned to not have a specific doctor, but they know, okay, my ear hurts, I'm going to that ENT, or my belly hurts, I need to see the gastroenterologist. But in a way,
but you don't have someone looking at from a higher level.
Yes, or I have patients coming with like a bunch of studies and exams and they've seen all the specialists, and nobody was able to help them because they all look at their perspective. But then as a GP or a family practitioner, you look at the person.
Yeah.
Not at the organ, that's my specialty. I look at everything. So then I try to fit the pieces and try to make something out of it. I'm not always successful because the human body is very interesting. But I do try to find the connection.
Yeah, I think that's fantastic. But you talked about like an open versus closed system before, and I'm going to take a slightly different tact on that. So when I go to a new doctor, obviously we go through the history and they ask a bunch of questions, but all that history does get lost over time, you know, if it's not centralized and you know, all that sort of stuff. And so my question is, my assumption here is that there is no central repository of information.
No.
So is there like information sharing that happens between doctors or just happens between facilities?
Not a lot. Yeah. So actually, because I worked in both sectors, I can see the difference. Within the public healthcare sector, you have references and contra-references. Meaning you send the patient off to the cardiologist needs to contra-reference and put what he said and did and whatever, and that you know. Here, at the beginning, I was sending off patients because, of course, I can't resolve everything. I need help. I need a group. I need a group where I can rely on. My network, that's how I call it. Yeah. And I was sending off to a cardiologist, and I didn't see the patient anymore. And it's like, okay, I want to know what happened, but I'm a curious person from nature, so I text the patients like, hey, what happened? Oh yeah, he did this and this and that, and I have to come back in a month, and then I have to do this. Like, okay, but
is someone going to tell me?
Yeah, is someone going to tell me this? I need to know that for future reference. If you come, I need to know that your medication has been changed, or that you've had an echocardiogram and it shows that there are some problems there that we need to be aware of, which I can understand. If something else happens, I need to take that into consideration.
Yeah.
But there is no retroalimentation, and I've learned now who I can work with and trust, and they have learned to work with me too. So they don't always do it because they forget. Sometimes we get busy. I don't mind. I forget sometimes to respond right away too. But then they do get back to me and they let me know, yeah, you were right. We have to do this or that. So for me, that's been difficult having that.
That sounds like it's taken you quite a long time to build up that network of people that you can trust. I think that's probably for me as an outsider, that's the key element with doing any sort of business here, is that trust and coming back to you. Yeah. but it sounds like you have that now. You have that network.
Yes, I still lack a couple of specialities that I think like I know, but I'm working on it.
Okay.
I'm working in a way. You all are my guinea pigs. I send you over to the doctor, and I want to know, like, hey, what happened?
That's why you want that return information.
Yes,
as well.
because I need to know. I always have an idea. No, like in my mind, that's the diagnosis. I had that gut feeling, like I mentioned. For me, that's so important. It's like I feel that that's the problem. And I would want to think about doing that, but I don't feel confident enough to make that decision on my own. Mm-hmm. And I said, I need somebody who is an expert in that, telling me, yes, it is. And then if doctors usually concord or agree with me, to say it that way, if they agree with me, then I can trust them. Mm-hmm. I don't know if that's a good way of seeing it, but then I see at least, or if they start out with like a bunch of medicine and then you think, oh yeah, okay, why is this good for? What is this good for? There is a bit of a culture here too for being a good or a bad doctor. I sometimes don't even prescribe anything and just give alarm signs or whatever, or say like take that vitamin or drink some ginger tea or whatever, just something that you don't need medicine for everything. And then they're like, but aren't you going to prescribe me something? It's like,
so
no.
You feel like the patients are judging you as a good or bad doctor, or you feel like the doctors are judging you as good or bad? Like, how are you?
I wouldn't say that. I think among Ecuadorians, they do look at how expensive medicine you prescribe, because sometimes they prescribe a lot of very expensive medicine and they think that's good, but that's not always necessary. The other doctors, I don't really know how they look at me, because I think they know how I look at them because I refer them patients. But I do have a couple of specialists now that actually refer me patients to. So I think the trust has worked both ways. And I just recently had a urologist who sent me a patient because he was having some digestive issues. And instead of sending him to the gastroenterologist, he sent him to me. So he knows that I can go deeper or not deeper. I look more holistic. Let's call it that word again, more openly.
And so I want to touch on some of the differences between the practice in Belgium and sort of what you're doing here, but I kind of want to segue using that last topic that we were in terms of communication and I guess collaboration amongst the different doctors. So what sort of differences do you notice here on that particular topic, but just with the healthcare systems in general?
Well, I was very blessed to come from a Belgian healthcare system where we work in teams, and the GP is a central figure in that team. So everyone knows you. Like in the hospitals, I was working with little hospitals around because I worked in a little village. So there was little hospitals. I had not a big hospital. The biggest one was Ghent, in where I studied. But there, everybody knows the GP. And when a patient comes in, you have to say that's your GP, and all the information gets around. We have like in the US, you have My Health or My Chart. I don't know what it is exactly, but everything is on a portal. The same with Belgium. Everything is on a portal where you get registered with your GP, and the GP can see everything that happened to you because you're his GP. Even if the patient doesn't come to you, we can look up and see, okay, what happened to that patient. Here, there is no system. Even within a hospital, there is no system. It's not like you go and see within X hospital, you go and see the dermatologist, and then you go and see the infection.
So there's no hospital system.
There is no system. Wow. No, everybody has its system, but it's not that you can look at the file of your colleague. So nothing is centralized, which a lot of information goes lost. Meaning, for example, you go to see that specialist, orders a bunch of tests. You do that in an Echis lab. Then you go to another specialist, order another bunch of tests. But he says, go to that lab. But to the same test in less than a month. That's a lot of money for patients. Sometimes we're talking about perhaps $150, but that you're paying twice because there's no communication. I always tell my patients, bring the latest test results with you, share me your results, and I see if we need to do something else. But I won't say, oh, okay, let's just do everything again.
I have found that I find myself, and this is not something that I'm good at, but I have to be a little bit more proactive with my medical needs, I guess. And Michelle, my partner, she is fantastic with that because she's grown up in the system.
Yes.
But then you ask me, and you ask just the general questions, like, I don't know, I'm assuming you have the record somewhere, but no, there is no record somewhere. So it's like, oh man, what was that thing I had last year? And so it's actually a little bit tougher it puts more of an onus, I guess, on some of the patients compared to where you're from.
And that's where a GP could come in handy, because the GP is the person who centralizes your medical file. We're the guardians of your health. And we don't always do, because here there's like a bit of, it's not in the US or in Canada or where we use GPs, or even in Europe. A GP is used. That's why I have a lot of patients, because that's where my patient population comes from. But in Ecuadorian terms, it's like, okay, they keep then all their records and they know and they have it all, but they should not be doing that. They sometimes get things misplaced, and it's like, not recently, but I had a patient as well that forgot that she had a hysterectomy, and she came for a pap smear. She was 70 something, an Ecuadorian, and you think, okay, but why did she forgot she had a hysterectomy for fibroids. You don't have to have pap smears anymore after 65, and less when you're 70. But she said, no, I need a pap smear. Okay, so you go in and you're looking and looking and looking, and you start sweating and thinking, okay, what's happening? Okay, and then you feel ashamed, like, I can't find your cervix. And then I was like, but I really, like, can I try to, because with the speculum, I said, okay, I'll see if they've shrunk something. So I wanted to do a tact. And then all of a sudden, I think I remember I did have a surgery once. It's like, okay, what did you have? I had fibroids or something. Okay. Let's just close the books.
We found it. Yeah.
So that's something that happens among more Ecuadorians. Could be happening around expats too, of course.
Especially when you start talking about memory loss issues as well. No, it's a legitimate
issue, and it happens more than you think.
That's the processes in general. I don't want to go down this rabbit hole, but processes in general, it's a little bit of a pet peeve of mine in Ecuador. Most businesses just don't have any processes. But anyway, that's a whole different topic.
But it's true. There is no structure. That's what I would call it. Organization, yes, but no structure. Yeah. Like, everybody does it for its own. Like, even within hospitals, it should be, and some hospitals do use a team for a case, and then they do case studies. But that doesn't happen all the time.
But even then, it sounds like that information's siloed within that team.
Yeah, and it's just that team that gives an opinion on that patient. Yeah. But it's not that patient is shared. It's just an opinion. Yeah.
So that's a big difference, obviously. Just the structure and organization. Another big difference, and one of the expats always like to talk about, is the cost. The cost of hospital care, or just medical care in general. Can you walk me through how that is different compared to other places that you've worked? Is it just Belgium that you've worked, or have you worked in
just Belgium? Yes.
But how much work did you do in Belgium, and how do the systems there sort of differentiate in terms of pricing?
So I did 3 years of family medicine and 1 year of an intern year. Yeah. So that's the practice I had there, because after my residency I moved to Ecuador. Yeah. So our system, there is no public, in Belgium at least, there is no public or private. Everybody has a right for healthcare. We do pay for it. Yeah, we have a health insurance that's more than just a health insurance, but it is kind of an insurance for when you go to the doctor, when you go to the hospital, get some tests done, where according to your income, you have to pay a certain percentage. For example, for me, 9 years ago when I was working in Belgium, a GP's office visit, let's just say, was $30. Yeah. At that time, sure. $30, but the patient had to pay only $4. Yeah. And the rest, your social security, in a way, it's like a social security. It's not the same as in the US, but we call it more as a social mutuality. That's how we would translate it. Yep. But it's a type of social security, pays the rest. And we had to fill in a paper as a doctor where they get paid, give that to that insurance or social security, and they get their money back, or they do it with third payer system that we get the money back after a month. You can choose how you want to do it. Now it's new because now it's not any, now it's everybody just pays the copay.
Got it.
That's how it is.
What I'm hearing though is like pretty much it's accessible for pretty much everybody.
Yeah.
That's the
Even
idea.
people who don't have any papers, like illegals. We have a lot of illegals in the big cities.
Yeah.
And when I was doing one of my internships in family practitioner as well, I was doing at a group practice in Ghent, but where we have like a lot of illegals, expats too, from Arabs, Africans. A lot of these people are there too. Some didn't have any papers. But we do attend them, and there's a special system for that too. So you as a doctor have to fill in a couple of paperworks, and that goes in there, and you get paid.
I'm assuming that's very different to here. Though those lower income, they do seem to fall through the gaps a little bit.
Yes. So here what we have is public and private. Public is free. Then you have something in between. You have the ISS system, which is like a social security as well, to put it that way, where you pay for it and you can volunteer to pay for it. Or when you work and you have somebody that offers you the job, he or she has to pay a part, or no, actually it's a part of your income that goes to that system. That's the IS. Yeah. Then you go to ISS and you get it also for free. But in a way, it's not free because you are paying for it. Yeah. And then you have the private, which is nothing is free, but where you can have health insurance, private health insurance that might be another topic where we can talk about, where supposedly you could get some money back or you just pay out of pocket. Mm-hmm. And then, of course, the costs are relatively accessible, I think, in Ecuador. It was always hard for me as well. Like, what price do I put on my services? So I started at really low, and then everybody was like, you're crazy.
That's a great deal.
Yeah, it's like, wow, I should come here often. But still, it was too low. And then even colleagues were saying, no, you can't do that. Because although there is nothing standardized, everybody does agree to more or less that should be the price.
Okay.
Yeah. Like, I don't know if it's still the case, but at least in 2019, 2020, I know that in hospital there's a minimum price that you have to ask for a fee, and then you can ask as much as you want, of course, but there is a minimum too.
So there's a minimum, but is there a maximum?
There is no maximum.
Okay.
Because I've heard horror stories as well of what the fees can be, horror stories.
But generally for me, like a standard visit, I assumed that there was some sort of collusion in place because it was all, roughly the same, between 30 and 50, is the...
More or less the standard is what my fee is as well. It's $40. That's the standard. There might be a couple of centers that more open to perhaps people who have lower income, and charge $15 or $20. Yeah. I actually worked as well because I worked 4 years at the public university, the Estatal, the University of Cuenca. And when I was in one of my last years that I was still working there, they opened a center, CEM, it's called Centro de Especialidades Médicas. And the office visit there was $7.
Wow.
Yeah, and it's accessible for a lot of people.
What's the minimum then if it's $7?
I don't know what the zero. I've given consultations for free too. Sometimes you can't. People are in need, and I will never neglect somebody in need. I've had patients say, "Oh, doctor, I didn't come because I had too much expenses that month, and I'm living out of my social security, and I couldn't pay you." It's like, never ever feel that you need, well, of course you need to, well, it's hard to say. It is my living. It is my living, of course, and I live out of that. Yeah. But if somebody is in need and can't pay me, I will still give that person the time he needs or she needs. So for me, that's not the issue. Of course, it is my living, like I said, but we'll never neglect somebody because they can't pay me, and I know that they will recompensate perhaps in the future, or some people then I don't. In Belgium, it was sometimes that people come with some pumpkins or zucchinis because I helped them out and I didn't charge them, for example.
Wow,
yeah.
That's really cool.
So.
So have you been paid in fruits here in Ecuador?
I actually, from Ecuadorians, yes.
Yeah.
They brought some from their garden
That's
and some fruits. In Guachapala, actually, I got that sometimes. Well, they didn't have to pay for it, but sometimes people are so.
Grateful.
Yeah, so grateful, and whatever they have in their garden, that's what they brought with them. And I always say, but no, you keep it, it's for you. No, you have to take this.
You have to take it.
Yes, you can't.
Don't insult them.
No, yeah, even if it's coffee with a bunch of sugar, you just drink it through.
Thank you. I don't want to dig too deep down this hole, but I do want to touch on the insurance side of things just a tiny bit. So, from your regular client base, how do most people pay you? Like, are most people with private insurance, or most people just paying everything out of pocket, or self-insuring, I guess you would call it?
Yeah. So most of my patients nowadays do have a health insurance, a private health insurance. There are a couple of them on the market, some better than other, of course, in my opinion. But most of them that do have it because, like I said, most of my patients are expats, and nowadays they're requiring it for the visa application. So they get insurance.
Especially this here in the Zogas.
They're very strict. Yeah. And they do ask it, and people get it. And I'm not affiliated with any insurance company. Mm-hmm. I was thinking about it, and I'm still thinking about it, but I'm not so sure still if I want to. It's still a discussion that's open to me. Because if I'm not associated with one of the insurances, people have to pay out of pocket to me, also out of pocket for all their tests that are included with that visit and follow-up visit, everything included, they have to pay out of pocket. I fill in the paperwork, they submit it, they have to do that within 90 days, and then they get about 80% back if the insurance company approves.
Yeah. And what do you get details like on the approval rate, so to speak?
Well, sometimes the brokers themselves, they contact me, say that the claim was denied, that we need this and this kind of document. Can you help me with that? Right. And I do. Sure. Yeah, I think here the brokers, they do like me because I'm not a perfectionist, but perhaps a little bit of OCD, who knows. But I like to, I have a patient that day who has insurance, or nowadays I have quite some patients with insurance. At night, that's my nighttime job. I am a doctor in the morning, afternoon, mom by the late afternoon, evening, and then the kids go to bed, and I'm again. I do administrative work. I'm the secretary of myself, so that's a bit how my day looks like. And then of course it's paperwork, but I want to get it done that day. Mm-hmm. Some days I have too many, and I do take me 2 days. But then the next day, the first is the last one I couldn't do the day before. So I do it on time. I know here that a lot of doctors including me, hate insurance work because it's just time consuming and it doesn't always benefit the patients, because I don't know how it is elsewhere, because in Belgium we don't have that system, but a lot of claims get denied. They always find a little loophole, or it's like, this is pre-existing. I had a patient who never in her life had hypothyroidism. She came because her hair was falling out. I diagnosed her with hypothyroidism. She couldn't prove that in the last 2 years she never was diagnosed because she never went to the doctor.
How do you prove something that?
They wanted from the last 2 years medical files to show that she never was diagnosed with hypothyroidism. She couldn't prove it because in 10 years she hadn't gone, and 10 years ago she had a colonoscopy. So it's not that that's anything in there, it's just a colonoscopy. And they wouldn't...
That seems weird.
I
would challenge that for sure. What is the process to challenge one of these?
Sometimes you have to get a lawyer nowadays.
You can't just go to superintendencia. It's more than that.
It's more than that. It's more complicated. I don't know really. I've said to patients, no, you have to. And even called up the brokers, how is this possible? Are you saying then that I'm lying? Because I'm saying this is the first diagnosis.
Yeah.
She came because not for anything else, but she came for her hair loss. So why are you denying this claim? This is just absurd. No, we can't do anything. The insurance company, that's what they say.
So I understand the challenge of being affiliated, with
There are
insurance
pros and
company.
cons. Yeah, insurances can help perhaps for major medical,
Mm-hmm.
but for small things, for example, I don't know any insurance company so far. People can correct me if I'm wrong or show me evidence if I'm wrong. If you come for what is very important in family medicine, a health checkup just to see how am I, yeah, being proactive on your health, knowing, do I have any risks of getting diabetes, or is my cholesterol well, or is my kidney functioning well? You never know, yeah, or is something going on with my prostate or something. Just a health checkup.
So anything preventative is really
is
looked
hard
upon by the insurance companies as
because if you put as a diagnosed health, like control de salud is just a health checkup, they will not pay for it.
Yeah, right.
They will not, because there's nothing wrong in your labs. They should be happy there's nothing wrong in their labs because they don't have to pay for anything more.
Exactly. It does seem a little bit short-sighted.
It is. And it's actually, why should I invent myself a diagnosis that should fit with all the tests that I'm doing? Because in a way, we shouldn't invent anything. It's good. The patient is coming for a health checkup. Of course, he doesn't have to come every 3 months and then do every 3 months the same test. Then there should be limits. Like once a year, you can have a complete checkup and see how things are.
Coming back to the payments, Maité, one thing I do want to touch on quickly is just the prescription side of things. So how would you, I know you said before the availability of the different prescriptions is really a bit of a key issue sometimes, but how would you rate the costs? Because I know, for example, I speak with a lot of expats from the US, and one of their main reasons for coming here a lot of the time is we just can't afford the healthcare in the US anymore. And so we do get this case of, you can call them economic or financial refugees if you want, but ultimately their system has let them down and they can't afford it anymore. And a big part of that, or at least a portion of that, is the drugs, the drug costs, with the brand names and all that sort of stuff here. So I do understand at a higher level there does seem to be cost benefits with the medications in Ecuador, but can you just walk me through that? Is that true benefits? Or am I, a little bit mistaken, or is it only certain circumstances that rings true?
Yeah. So it's a bit more complex than that. It's true that overall healthcare costs are way down. Yeah. And sometimes I've had two sides, people who say, I now have to pay out of pocket. Before my insurance was covering because I was working and I had insurance. Now, if they then would see what the cost would be when they would not work, that would be different, but they have no idea about that. Yeah. Generally speaking, medication-wise, you can, depends on what your health situation is okay. But I have patients with rheumatoid arthritis who need infusions twice a month or injections, and the cost can run up to $5,000 a month. Here.
Wow.
Yeah. But if you have just a little bit of diabetes, high blood pressure, cholesterol, it would be around $150 perhaps a month compared to thousands in the US.
Got it.
Of course, there is no good division in between generics and brands. I have learned that now too. The generics, I come from a culture where we only prescribe generics because we are controlled by the government and we can only, and the pharmacy can give out what he wants, but we have to prescribe generic. And here, I was doing that at the beginning, but I've started noticing with a couple of brands, of generic brands, that, for example, a blood pressure was starting to be like, oh, what's happening? Why is it fluctuating? Why is it getting high and all of a sudden low? And then it's really on, like, what happened? Is there something that happened? No. And then I started asking, like, did you change your brand of your medicine? Oh, my pharmacy gave me this and said that this would be better. It's the same, but it would be better. It's cheaper perhaps, but it's not better. And I said, no, go back on the brand name just to see if this is it. And it made a huge difference.
Wow.
But brand names can go up to double, triple of the cost. So that can make it more expensive in the month. But then there are some brands that do go for low cost and affordable prices, even pharmacies. There's a huge difference in pharmacies here. There are no government pharmacies anymore, but the one that was a government pharmacy keeps really low costs. That might be like 30% less than you would have in one of the big pharmacies.
Is that Pharmasol or what's that?
Corp Desfa. Corp-DESFA used to be IMFA. That's how the Ecuadorians know it better. It was a government-sponsored pharmacy. And they were then bought by this huge company. Corp-DESFA is something with Corporación de Desarrollo Familiar, something, a long name, yeah? And a big company bought that, but they are so popular, they're so big that they can remain on low costs. And it's 30% difference. The second lower pharmacy or the cost is Pharmasol, which is from the municipio. And the municipio tries to offer accessible health. Now they've recently put a cancer center as well from Pharmasol where you can get your treatment for a cancer, which is accessible and at a lower cost. Because that's another one that can be very high in cost. Chemotherapy. One chemotherapy can be easily $2,000. Yep. But if you have to have that every 3 weeks or every 2 weeks, 6-7 sessions, the costs come up. Yeah. And then chemotherapy, whatever, radiotherapy, it can go up. Yeah. So then you think if you have then, for example, Medicare in the US, I say to people who have a diagnosis with cancer, I say, if you still have Medicare, go back and get your treatments.
Yeah. So,
but others are very accessible.
Yeah. So so obviously, everyone comes here with their own issues, their own medication, their own story. What general advice do you have to expats that are coming here that have their history? For example, like just knowing that the medication is available or is it not, or even what you're telling me is like the generics versus the name brand, there might be a difference in the quality. So how does someone that's living in the US considering moving here to Cuenca, how do they figure that out?
Get in touch with a GP.
There you go.
It's not that I want to promote myself, but
I don't know any other way. I know Tribeca has like a list of medicines and stuff like that, but that's also incomplete.
That's what you're going for. I look online too, and I look on Tribeca. Medicity nowadays has a list of their medicines. Montesinaí has a very, very big pharmacy too. Yep. Then there is a very famous pharmacist too that helps me out too with like, do you have this? Do we don't have this? Usually it's better to have like, okay, if we don't have, especially for mental health, we don't have that much options. We don't have the newer treatments yet. And even for anxiety disorders, complex anxiety disorders, sleep disorders, we don't always have all the medication available. I have patients who have contacted me that are not my patients then, but have contacted me and said, I have this as my background. This is my medication that I take. Is it okay for me to come? Is this available? And then for some patients, I've said, well, this we don't have. So you might ask your GP in the US or wherever you're coming from to see if you can switch it to something like we have these options here for this kind of treatment. Is it something you can work out? Better to get you stabilized before you come here, because moving is a stressful episode in your life, especially from another country to a new culture, a new language. That brings a lot of stress with people.
There's a lot of new variables as well.
Yeah.
New lifestyle.
So changing then your mental health medication before or when you're here, it's not possible. Yeah. Or then I ask them, for example, ask to get enough supply, ask you get a 3 to 6 month supply of your medicine. And then while you're here, we can work on changing it to something we have here. Another important one is not only mental health, is pain management. Yeah. We are a little bit limited here in good quality pain medication. Yeah. For example, oxycodone, which is very commonly prescribed in the US. We have oxycodone here, but it doesn't work that well. Yeah. I don't know how to explain it.
I was talking to a friend with this exact issue the other day, and they're really struggling because that's probably the biggest impact on them is like, okay, in the US, I was getting some variant of oxycodone. I'm not sure exactly what it was, but yeah, that simply wasn't here. And the impact on his life, he's really struggling to get that drug here. And so he's trying to find an alternate, and it's tough. But
these drugs are not easily prescribed for long term by pain specialists in the US because there's so much control on it, which I understand. We have in Belgium, in Ecuador, we have a lot of medicines. You can just go over the counter. Yeah, you just go to the pharmacy. The pharmacy pharmacy can even... The pharmacy, to put it that way, the pharmacy is the GP of all the people here. Mm-hmm. That's how I see it. The pharmacist is the GP. So even prescribes antibiotics, sleep medication, all of it.
I was going to dig into that, and I do want to dig into that. So what I've noticed that, they're a little bit more liberal here at the pharmacies. So where do those limits start and end, though? At the pharmacy, what can you get and what can you not get at the pharmacy?
So normally you can get everything except addictive medicine. For example, benzodiazepines, which is like Xanax, alprazolam, clonazepam, diazepam. But diazepam, for example, we only have in vials, and a lot of people take medicine for it, which controls anxiety, which controls sometimes for sleep. But we only have the vials. But that's a controlled medicine. Then other controlled are like morphine. Oxycodone. We do have oxycodone, but the quality is really not the same. I don't know why. I can't give you a reason, but I've seen it not work on my patients.
Sure.
Then like fentanyl we can get, buprenorphine, which is patches for pain as well. So we can get that, but this is prescribed medicine. And there is, nowadays, I've seen that there is more control on it. Meaning, although we don't have pharmacies that keep track of it, but the government does keep track on some pharmacists where they see they go more out these kind of medicine, and then they ask for the prescriptions, and then they go to the doctor and ask, okay, why is he getting so much? Why this? Why that? So they're starting to develop a little bit that system, but that's the only prescription, and that's a prescription you can only as a doctor get from the government. They're doubled. You have to, and it's still handwritten, but it's like people who have seen it as this big prescription, and you're like 5 minutes writing everything down that you need to write down, and then they can go and get it. But otherwise, supposedly there is more control on antibiotic prescriptions because there's so much bad use of antibiotics. The world has gone very resistant on a lot of strains of bacteria. We're getting to be very limited. I've seen it in patients. We are sometimes very limited in what we can give as an antibiotic because here you go to the pharmacy, who is your GP, and tells, oh, I'm having a little bit of a sore throat and I'm starting to cough a little bit. However, 90% is viral, but the pharmacy will give you azithromycin
because they're a good pharmacist.
Yeah, and then they'll give you everything on top of it, a bit of NSAIDs, a little bit of Tylenol,
body's
and
basically
then whatever.
Immune to everything.
Yeah.
Wow.
Or you go for a UTI, but I've had it. You go to the pharmacy, a patient of mine goes to the pharmacy without asking me first, and he said, I think I have a UTI. The pharmacist gives the worst antibiotic you can give, that the strains, it's one of the sulfa drugs that actually it's out of guidelines because there are so many resistant strains to it, gives that antibiotic and gives vaginal ovules for just in case you have a yeast infection, a vaginal yeast infection. Like overshooting. And then of course that patient comes to see me because after a week she's still having symptoms.
Got it. Wow. Yeah, no, that's a very tricky one. And the prescription medicine, I think that's fantastic that you've dug into that a little bit. So I've got a good understanding of that. But still on the cost subject a little bit, I do want to dig into the hospitals. So like, I know, especially when you pay for surgery, right? This happened to us a couple of times. And as a newcomer to the system, it's a little bit shocking. It's like, okay, I have a surgery, but then they literally lock you in a room until you pay the bill, until you can sort of go home. And I get it, everyone needs to pay their bills and stuff, but this seems like a very draconian way to enforce those bills being paid. Is that standard for every hospital here, or can you just walk me through that payment process in particular?
Well, it's fairly standard for most private hospitals. When you go into the hospital for surgery, you have to fill in dozens of papers. You have to have credit card numbers or debit card numbers. You have to show that you have the money to pay. For some people, like if you go in through emergency where it's nothing planned, and I feel they have only done that in expat, that's just my personal opinion, of course, they have to pay up front like $5,000. Up front, or they won't take you up. They won't take you to a room and you stay in emergency room.
That's crazy. So that is crazy. Prepay. That's insane.
Even if you're not going to spend the $5,000, you have to pay $5,000 in order to get up to a room. Yeah, I'm saying I've had 5, I've had 2,000. It depends a bit on who or what the problem is. And it's true, when you have to check out, if you've not paid anything up front, of course, they won't discharge you until you're paid up.
What happens then? Like, literally, I'm assuming there's cases where expats or anyone just doesn't have the money. What happens then?
Well, I've not had a case where it couldn't happen. I've had one patient recently, a couple of months ago, who had to have heart surgery, and then he had to have a bypass in his legs too for obstruction, and they couldn't pay the whole bill. So they end up owing the hospital perhaps, I would say, $7,000. The hospital let them go, for sure, because the cost would only get up and up and up, and they could not get more. But they let them out with a promise that they would pay.
Got it, okay.
Because they do have insurance, and they had to pay up front. And then, of course, they are going to see how much the insurance is going to give them back so that they can pay.
It's a pretty difficult
hospital.
situation, and obviously
It
not
is.
something that patients want to be. It's a stressful time, obviously for everybody involved. So just being, sort of really forced into that position of financial difficulty is it just doesn't feel right with me. But I also understand the hospitals need to get that money back, and the debt collection system and all that is not so great. So
No.
I understand why they do it, but still,
But it's not humane.
It doesn't. Yeah, exactly. It doesn't feel right.
That's my
to
opinion
me.
too. I've had cases too that I think but the patient will pay. But I have horror stories and good stories. But I've had stories where, for example, they weren't sure a patient is here alone. They weren't sure that she was going to be able to pay for it, and they neglected her.
Yeah, wow.
So the care and quality of care.
Huh.
My suggestion for people who come here, well, if you're having elective surgery, all good, and you're going to pay for it, you have the money, okay, I have to save up, or I can get my credit card up to that limit. With a normal elective surgery, if everything goes well, of course, you have a number. They always tell you that surgery is $8,000.
Got it.
Or $10,000, whatever it has to cost. That's what I have to have, but always have a little bit of a spare room, because there can be complications, you can have a post-op infection, whatever, yeah? So you have to have
so for
some
like
spare...
20% aside or something like that.
Yeah,
just in
so
case.
to have that room to move, and that's with an elective surgery.
Yeah.
When something major is going on and you need to go to an emergency room, if you you can't have the money up front because they will ask for it, go to the public hospital. Mm-hmm. The public hospital, I must say, has good quality service. The only thing is they're broke. They do pay their medics. They do pay their staff is paid for, but sometimes they don't even have money for gloves. I'm just saying something. And then you have to go to the nearest pharmacy and pay for the gloves, or pay for the antibiotics, pay for a specific medication. Well, that's always better than just pay the whole price at the hospital.
Right. But you're saying with the public system there, or the ES system?
The public,
Yeah.
the Hospital Vicente Corral Moscoso. I do strongly believe the quality of care that they give.
Even with the ESS hospitals, I've heard similar stories that you got to bring your own supplies.
Because nowadays they're broke. Yeah, but otherwise it wasn't that way.
Yeah.
But ISS still, you're then limited because, for example, you have to have a knee surgery, but it's fairly urgent, but they don't have the specialties there now, and you can have the knee surgery in 3 months. Well, in 3 months, a lot can happen. You just...
Of course. Absolutely.
So.
The cost, we could probably talk about that all day. It is a very interesting topic, but I do want to move on to some other ones. And for me, communication. So probably my biggest surprise about Ecuador's healthcare system was the direct communication with doctors. I was shocked the first time that I was there with Michelle. And she was WhatsApping her doctor, I think it was like 8 o'clock at night. And I was like in horror. I was like, what are you doing? The doctor's going to bar you. They're never going to talk to us again. And then lo and behold, she actually got some sort of response that night. And I was like, that poor doctor. That was literally my thought. I was like, as a patient, obviously that is fantastic, to get that level of personalized service. But as a doctor, I can just imagine that is just a nightmare for you. Like, how do you deal with that? And what sort of barriers do you have to put on patients when it comes to that?
Well, I like to be available for my patients because there is no system that when you click off work, there is a guard system that goes into as a family practitioner. That's the system I worked in.
Yep.
So I worked until 7 p.m. and then if I was on guard, I kept my phone on. If I wasn't on guard, I put it off. But I know that there's a doctor who's going to respond to messages.
Yep.
Yeah. Here, there is none. There is no safety net. There is no nobody helping you around this, so you're on your own, to put it that way. I know that, and also my time, that's why I respond so late at night as well. I can't be busy during the day when I'm with my patients. I give my patients the full attention, and I think most doctors here do that. You're not with your phone texting while you're with a patient. So I text back when I have time, and usually that's after 8 or 8:30, 9, depending on how early the kids go to bed. But that's my time. And even on the weekend, sometimes I don't even look my phone because I promised my kids I will not. And I said I'll be with them. But it's hard because you have to be available. There can be an emergency. And for me, the emergency system here is still not the way I want it. Like 911 for me does not work. I've tried it now a zillion times. I don't know when you can call 911. You can't call them when you're dead. Dead, I mean. You can't call them when you're having I had a patient fall down off his bed. He had a spasm or an epileptic convulsion. I don't know what actually happened. He was locked down on the floor, couldn't move. And I called 911 because I couldn't go there right away. I called 911 for him because, for language barrier or whatever. They wouldn't come.
Wow.
That person is on the floor, can't move, can't get out. He's all alone. He's in pain. Well, is he dying? Have you seen him? So that's why I'm available. Yeah. And not everybody does that. I do have colleagues who say, but why are you responding to your patients? And why are you just bring them up to an appointment. You shouldn't, how to say it? You should give them an appointment or a follow-up, like if you do blood test results. Make them come to your office. Why are you at 10, 11 p.m. texting down the results of their blood work? But sometimes that saves me some time too, because why should a patient go to my office to tell them you're all good? Yeah, or watch your cholesterol a bit, and we'll see each other next in the 3 months or 6 months. It doesn't. When there is something that needs to be discussed further, even if it's nothing serious, I will tell them to come. But
do some patients take that a little bit too far?
Yes.
Take the piss, as we would say in Australia a little bit.
They do.
Yeah. Do you have to put up boundaries then? Or how
sometimes
do
I do. Yeah. Sometimes I say, but it's enough. Yeah. Please come to the appointment. And then I don't hear from them anymore. Right. I've had patients I saw only once and have WhatsApped with them for over 2 years. And I said, but it's enough.
Yeah.
That's it's huge. My patients, I have a lot of patients, but it runs up. And then it was nothing major or serious. That's why I always said, okay, no, we'll watch it out or whatever. But then done. Yeah. Or I have had patients when I don't respond them right away. I do have other stuff to do. Yeah. When I don't respond them right away. Oh, I'm not available. You're not available. I need a doctor who is available, who will answer my calls right away. And it's like, good luck finding one. Yeah. I think I've done quite a lot, more than, if I talk with colleagues, more than anybody else.
You can never please everybody all the time.
No. And I do sometimes get hurt by it because then you think, I've poured my soul and heart in this.
2 years worth of free advice, and now all of a sudden...
this is how you treat me. Okay, would you do that in the US? Because sometimes it's US, I'm just saying a country to say something. Would you do that in the US?
Good luck. Good luck communicating with your doctor in the US.
So you have to, I treat you with respect, but you have to treat me with respect as well.
I think that's just in general, good advice for everybody. We're in the same thing. We do a lot of real estate stuff, and we deal with a lot of people that aren't even in Ecuador yet. But these people, these are like 2 years before they get here, and so they do look for a lot of free advice and stuff, and that's okay up to a certain point.
At a certain point, yeah.
But what often happens is that I do feel like there is a little bit of abuse of that as well, that they get all the information that they want and thank you very much, and then whatever.
And then ciao.
Exactly.
You give them a finger and it's the whole arm. But like in a way, I will never change who I am. I want to be available. I do need to find, but that's something personal for myself, perhaps a better system to filtrate messages, because sometimes I've had days where I receive 90 different, that's my record, 91
that's
in one day from different
WhatsApp wasn't built for that sort of
No, and my
communication
phone
management.
gets crazy. And that's not counting the emails with
Yes,
that.
yes.
That was my record, yeah.
Wow.
And I was like, one day it's like, but I can't filter that. Even when I want to, I have a system where I try to filter a bit the messages, but I can't filter that many. And then some emergent message slips through it, and I only see it around 10 p.m. and I feel bad about it, but I don't know how I can do it differently. I need to have
it's
a
not the right
secretary.
tool.
Yeah,
You
no,
definitely
it's
need
not
a
the right tool.
secretary.
And I was thinking I do need a secretary, but here having a secretary is also difficult.
Yeah.
I've tried, I look for it, and for me, it has to speak already like I don't know 4
4.5
languages because of all my patients.
Yeah.
But no, that's not a requirement. But I'm also
But at least English, I'm assuming.
at least
they will have to,
English,
yeah?
English for sure. Because most is Spanish or English, they can make themselves work out that way. But I do have to. I want to have as well that flexibility I still have, but I can't find a real balance in between it. But I know that I'm available for patients at 10 p.m. But the other doctors aren't. I have doctor or patients that said, but I wrote to that doctor and he never responds to me. It's like, what did you ask him? Mm-hmm. Did you ask him advice? If you asked him advice, he will not respond. Ask him for an appointment to get some advice, he will respond. Yeah. So even if it's perhaps 10 p.m., he will respond and give you an appointment, or give you an appointment through his secretary. Yeah.
No, I understand. That's really good advice to people as well. If your messages aren't going answered, maybe change the tact a little bit, because people communicate here very differently. So I think that's really nice.
Or they can get offended. That's what I hear from colleagues too. Yeah. Sometimes the way the patient talks to me.
We're very much to the point.
Yeah.
A lot of the time.
And that can be very direct. Yeah. So why aren't you not responding my messages? You can say like, did you get my message? Can we talk, or should I set up an appointment instead of why aren't you not responding my messages?
Yeah. Don't you have anything better to do? Passive aggressive is not going to get
and doctors do feel offended by it. I sometimes have to say to my colleagues, but don't take it personally. It's just the way they are. They upfront with their health. They want to know what's going on. They want to. It's not like the doctor tells me I have. I don't know, I'm trying to look for something. I have a high blood pressure and I have to take that medicine. Yeah. But then they don't, why am I having a high blood pressure? What's going on with my blood work? Is this something that I need to change? Is it my kidneys? Is it my liver? And they will ask a lot of questions. Here, they're not used to that, being a part of their health. I've had Ecuadorians too. Well, not only, I have a couple of expats that I was, my education comes that as a GP, I am a team. Yeah, I'm perhaps a lead player in the team, but I am a team. Yeah, and my patient has a right to make decisions in his own health. It's that person. Yeah, so I give them options, and then they're looking at me, but you're the doctor. You should know what to do. It's like, I know what to do. We have these options. Yeah. No, but.
Tell me which one. Like,
which one? Yeah. It's like, for me, all of them are good. Yeah. What's the one that you prefer? Yeah. And then they're like, they can't choose. And then sometimes they do ask, what would you do? It's like, for me personally, I would go for this, but that might not be the right decision for you. Yeah. And I'm okay with all these 3 options, but people are like, can I make a decision in my own health? It's like, this is how we were educated. We are a team. Yeah. So, and that makes sometimes some awkward situations.
I can imagine. But just taking control of your healthcare again, that's something that I have noticed that we have to do a little bit more here. But just moving,
with communication, yeah.
Exactly. I am concerned that, this interview has turned a little bit negative towards, the system in Ecuador and whatnot, and that's not the intent.
No.
What I'd love to do is, maybe just focus on, some of the positives of the healthcare system here as you see them as a practitioner.
Okay. I, as a practitioner, first of all, love working here, even with the difficulties I've noticed, because I was fortunate to come as well from this privileged situation of Belgium. But here, the accessibility of healthcare is incredibly. You order tests in the morning, you have in the afternoon, you have already the results. I have a liberty to go to the imaging place and ask directly for an MRI. Why should I be running around and doing an X-ray knowing that the X-ray is not going to say anything and I need to do the MRI right away? Why around the bush, run around the bush, if you can go directly to the point? In most systems, you have to go through the system. Yeah. And that's I love about here, the flexibility, the liberty that we have, the good quality of care. Nowadays, Ecuador, like even Quito, if I can't find what I want, I know in Quito they have it. It's the newer machines are coming in for testing. We're getting things that we didn't have. So Ecuador is developing, and in a good way, and in a good accessible way, which is still affordable. Yeah, it's very affordable. An MRI.
So the corporates haven't sort of dug their claws into the system
Not yet. Yeah. Now, of course, hospitals have their policy, and the hospitals, especially private hospitals, it's a business, yeah? So you can't blame them. It's a business. But they're good hospitals, yeah? There's good quality care, health. And I, for one, I'm glad to be part of this healthcare system, and I will be for as long as I can, of course. And it's I see a lot of expats, and they are so impressed as well with how things work. It is a good place to come for healthcare.
I would probably, echo those sentiments in general. So we have had good quality care most of the time. One issue, which I wanted to come back to, that we've personally had, is just around the pregnancy and giving birth. We've really struggled to find a good gynecologist here that works on the same mindset that we do. So like natural birth, first if possible. But what we've found, and we've done a lot of searching in Cuenca, trying to find someone that really resonates with us, is that there is this sort of conservatism that tends to be there, especially when it comes to this particular part of the medical establishment, giving birth. I'd have a lot of doctors tend to want to schedule in the births and stuff like that. I'm not sure if that's just mainly for convenience, or if there's costs associated with that, or if it's just trying to limit their risk to a natural birth and the complications that can involve.
Which are actually less complications with natural birth than C-sections.
Well, I don't know. I mean, this is just my perception as an outsider. I'm going like, who's going to help us? Anybody?
It is hard. Yeah.
So that particular topic, I know you don't have the we've asked you this. I know you don't have the silver bullet answer. But I guess, are there any particular topics like that, like giving birth, or particular areas that you've found could really be improved in Cuenca?
One of them is exactly what you're talking about. There is I don't know how to phrase it, but the idea about giving birth here, which you think in Ecuador should be all natural, right? But if you go to the communities and little towns, they won't talk about C-section. Everything is natural, but then you go to the public health, not the ISS. It's natural until you can. But you go into the private sector, where doctors are used to planning their days. What's like time frame? A natural birth can be from up to, I won't say like 24 hours, labor and following and whatever. A C-section, 15 minutes and it's done. A C-section, the cost...
pretty convenient.
It's pretty convenient. A cost of a C-section, we're talking about perhaps $18,000. Cost of a natural birth, $10,000 now, perhaps, yeah, or even more. I don't know. I think it's a bit more even so. But the cost of what it is, the doctors don't have to get up in the middle of the night. Yeah, they can plan the birth. Yeah, even women here. When I was pregnant, my first baby, and they was like, "And how are you going to give birth, natural or C-section?" My mouth fell open. It's like, what are you asking me? Should I be concerned?
Yeah.
Like what? And I got a couple of these questions. Are you thinking about C-section or natural birth? It's like, this should not be a choice. But even women say, "Oh, I don't want to go to pain. I don't want to go to..." Yeah, just quickly get it out.
I understand if a woman's pushing the conversation.
But it shouldn't. It's a misconception. That's what I wanted to say. A misconception about birth. So the private sector has more than 90% that is C-sections.
That's
All
insane,
the rest,
right?
that's insane.
What would be the rate be in
the
Belgium,
right
for example?
from World Health Organization. I think it's 30%.
Wow, yeah.
That should be C-section. And in most countries, that's what they're striving to. Of course, there can be complications, and then you go into a C-section. But the birth is as natural as it can be, has been done for centuries, is not something complicated. I've done them in my lifetime too, like delivering babies. It's not that complicated, and most come out well. But of course, there's complications, and these complications, of course, has to be dealt with C-sections
Of
or
course,
whatever.
of course.
Yeah. Another part that I find that's very how to say it, that not put a lot of attention to it, is the part of palliative care. And Michelle can tell you all about that as well. Palliative care, I come from a country where we do that on a daily basis. Here, palliative, even the word palliative is something they don't really understand. They think they're going to do euthanasia. No, I've had it. It's like, oh, you killed a person. No, well, there is a big line between that. Yeah. And even euthanasia wasn't legal. Now, in certain circumstances, it is. But palliative care is more accompany somebody till their death, knowing that there is nothing curable. Why push them full with medicine and different drugs, not fluids, but like IVs and a billion of things that you're going to spend so much money on, and you're not going to accomplish anything by it because you know it's the same outcome. So what you do is you make the patient comfortable until the end, and you accompany him till the end. But that idea of death is something that is still very taboo. Yeah, even with my own husband, if I need to talk about a palliative patient and I need to able to get it off my chest, how much death talk is too much. You're making me stressed.
It's a really tough subject, and you touched on this, and I appreciate that. Michelle does run the death cafes here, and that's the whole point of those cafes, that they're free. One's in English, one's in Spanish. The whole point is to open up those conversations, so people are at least comfortable. If this has to happen at some point, then they're not scared to take those first steps, and it's just a more. There's nothing nice about it, but it's just nicer.
It's
I guess.
hard, and even for me, being a doctor, I'm 11 years now, it's still hard on me if I have to tell a patient bad news and know that I have to accompany him until she dies. It's hard, but it can be beautiful too. Being there for somebody, making sure they're comfortable at their place with their loved ones, instead of a hospital pumping you full, giving another surgery, another this, and that.
I think it's great that you do. I honestly see a real big need, especially amongst the expat community that we deal with a lot. It's a really underserved part of the medical establishment.
It is.
I think that's fantastic. Last question is the future of medical care in Cuenca. How do you see it evolving, let's say over the next 5 years or so?
I see it very positive, actually, because we're working on a project too, my colleague, on how we can improve still more, give more quality care. And a lot of us, of doctors, are thinking the same way, especially in the things that are, or in the sectors that we still lack, like palliative care or even assisted living. Yeah, which is also a part that is very under
absolutely.
or there is no assisted living, let's call it this way. So there's a lot of projects coming for Cuenca that I know, and I've talked with doctors, I've talked with colleagues, friends. So I see the future pretty bright.
Well, let's definitely keep updated with those projects. I'm very excited about that, and just thank you very much for your time today and just sharing your experience about Cuenca's healthcare options. I've got a lot of value from it. But if someone does want to make an appointment with you, what is the best way for them to do that?
The best way is actually WhatsApp.
Amongst the 70 other people?
At 9-10 p.m. But no, a WhatsApp message is the easiest way, because I start first with WhatsApping. Calling is harder because I'm in the middle of a conversation, or not a conversation, I'm in the middle of an appointment. I don't answer my phone unless it's really like you're calling 5-6 times. I know there's something urgent, and I will answer the phone. Sure. But a WhatsApp message, I will get back to you usually within 24 to 48 hours.
I'll include those WhatsApp details in the description. Yeah. And so if you are looking for a caring, intelligent GP that speaks all of the languages, you really should give Maité a try. And we're just very glad that you've decided to call Cuenca your home. We're very happy with your care. So thank you very much, Maité, and thank you for tuning in. I do hope that you're able to answer, or hope that we were able to answer some of your questions about Cuenca's healthcare options. If you did get value from this, please do consider donating through our website to the Cuenca's charities. Not a single cent is retained by us. We do generate income through real estate sales and rentals. That is our primary business here at YapaTree. But do feel free to check out the listings on our website. If you're not sure whether Cuenca property market is right for you, we do offer real estate trips to help build your knowledge of the local market. However, if you are certain that the Cuenca market is for you and you want to buy, we do have a buyer's agent service that may be of interest. So thanks again for watching, and have a brilliant day. Ciao, ciao.